Every Child Matters is a programme that was introduced by the government to help the communication between social workers, schools/teachers, the police and the ambulance service to have a multi-agency service. This is because of the cases of Victoria Limbier and Baby P.
They make changes to school improvements, development plans. They aim for more improved meals and give them greater awareness of health and healthy eating. Take more time into who they are recruiting.
They will be monitoring data and the children's performance against the 5 outcomes and the framework, identifying and managing situations to the best way of the child, involving parents and careers in supporting the children's learning development.
They'll have better communication with parents or carers. For example, if a child is falling behind on work and the teacher thinks it's a result of something at home or something happening in schools itself, by bringing in the parents we can help each other in dealing with the situation, having care and help provided in needing the parents or carers and the child's best interests. The aim is to reduce the workload for teachers and giving them guidelines to follow and get things done quicker and more efficiently.
Having guidelines to follow makes things for teachers a lot easier in the fact that they are quick, simple and they have specific things to look out for, such as attitude of the child, their work and timekeeping. For example, if their work starts going downhill, then they should call a meeting to discuss why their work isn't meeting the needs and what they can do to sort it out. Also, to indicate if anything is going on quicker.
Having these guidelines to follow can make teachers' jobs a little harder as they are going from teaching to looking out for the aspects as well. It can give teachers more pressure on their job and make them maybe a little confused. For example, when teachers are at school, they may look more for anything going on with a child and end up teaching less or going a little off track.
It brings a lot of pressure and anxiety on social workers because the public have become more concerned and worried about the health and well-being of children. This is partly due to the Baby P tragedy and the death of Victoria Limbier.
Every Child Matters is a framework for all public services to follow. It creates clear instructions and guidelines to abide by. This put pressure on social workers as they had to follow the rules, so if they failed to work by the rules they would be in trouble. This article identifies and states the struggle social workers face. The Guardian made a survey for social workers to complete. Over 1,420 professionals across the UK took part. An example of the questions is they discovered that 92% of respondents feel spending cuts are affecting service levels and putting increased pressure on social workers.
This article includes the British Association of Social Workers' view on what they have heard about the pressure on social workers. The British Association of Social Workers, England's manager, Maris, stated that we are hearing concerns about increasing workload and long hours. People are telling us that they are too busy, they can't even fit time off in their diaries. Furthermore, they discussed the result of the survey and how they could help social workers' stress levels.
Every Child Matters outcome is to increase the focus on supporting families and carers. This affects social workers because it increases the connection and communication within public services, i.e. schools. Furthermore, it also raises awareness of children's health and well-being. This creates more anxiety and pressure for social workers as they will have to take more time and consideration within their job. Every Child Matters law was created with clear instructions and guidelines to oblige by, so they understood what they can and can't do. Also, putting more time into their work is better because it made sure that the cases like Baby P would not occur again.
By creating this law, it added a lot of pressure onto social workers as they had to follow rules and procedures to complete their job. Also, it increased connection and communication with children and the public services. This policy is justified because it helps abuse or neglect of children being noticed a lot quicker. This means that if it is, then the child can be put in a safer environment. This is all what needs to be done with the child's best interest and to give the child the best possible care and help provided.
This benefits the United Kingdom for the way that people, teachers and social workers can look out for specific things on what could be going on. It helps benefit those children that are being abused and hurt out there. This Act benefits the UK because it is worldwide and across the country. This means that it is well known throughout and people know what is wrong and what they should do in any case of a child getting abused. This affects society by the way people look at different situations and make assumptions to what's going on. This policy is one that affects everyone to how they feel about the situation and how they react to them. If someone knows their child is being abused, most people are going to want to do something to help that child, and in some cases the parents as well.
It does change what social workers have to do now when they go and visit parents and the children. Having police, teachers, social workers and anyone else dealing with children having guidelines so parents and carers know what their child will be safe and looked after.
This policy was created because of the Victoria Climby case. Baby P was unfortunate. He did not have social workers, however, when they came round, he was sat in the pram with chocolate round his face so they couldn't see the bruises. Now because of this, every social worker has to check the child or children so this incident doesn't happen again. The media was all over the case, which is why this Act came out. This made sure that everyone knew about Every Child Matters and knew that it was wrong for children or anyone in the case to be abused or hurt by anyone.